Thank you, Dr. Yu, for joining us today. We're very happy that you're here to contribute to this toolkit, with the intention of which is to support clinicians in learning more about how to best support families in the East Asian communities. So thank you very much for being here today.
I'm happy to be here. Thank you for inviting me.
Just to start off, can you tell us a little bit about yourself and your current role as it relates to the autism community?
I have many different hats, so I'm trying to think about what the best way to describe it is. So I am, first of all, a family doctor in a high needs community, and I look after a number of young families for their primary care needs, but as well as for special needs such as autism. I'm also a mother of 3 children, one of whom is now 18 years old and is in the spectrum. And I would consider myself an advocate from the perspective of health systems changes that need to happen so that we can deliver better care to young families and for children with autism.
Looking at the current diagnostic pathway for autism, currently what that looks like is if a parent, for example, has some concerns about speech delay, or a child is seen in an early on-center and the provider notes that there's a delay, the family is then seen by a family doctor who then refers them to a tertiary care center or a diagnostic hub to go through the assessment, and after which they receive a diagnosis. And this whole pathway from the first concern to diagnosis can take a little bit of time. Can you comment on, what are your thoughts on these current pathways to diagnosis for autism?
So, I mean, Manira, we've had the pleasure of working together on building better pathways. Certainly, this type of pathway is not easy to access or stay within. And I'm speaking from the perspective of a parent, but also as a primary care provider. It's a very prolonged pathway for what is a journey that is most often very difficult for parents and for children to get through. And so certainly there are many different ways in our local context in Ontario, for example, for us to get a diagnosis. While you've described a typical pathway, there are certainly other ways of finding a diagnosis for one's child, and I look forward to seeing more of those new pathways being developed.
So do you see any gaps in this current pathway that the majority of families is accessing at this time?
Would you like that in alphabetical order? There are certainly many gaps. Maybe the best way to sequence this is to think about the patient journey in itself. I think that the core the core circle that's around a child is often their parents and their school teachers and caregivers, and one can experience barriers from that first step of understanding whether there's an issue to even come to a healthcare provider to get advice on how to what might be needing a diagnosis or what might be needing support. So from the perspective of a family member, and from the perspective of the schools and the immediate caregivers around the child, there's barriers there. And then there's barriers once you come through to a family doctor's office, for example, or a nurse practitioner's office, where it can be very difficult to screen for autism amongst the many different issues or health needs that one has to look after in the primary care setting. And then there's that barrier between a positive screening test from a primary care provider's office and getting a specialist appointment or an appointment in a hub where a diagnosis can be made. So it's a long journey of many different gaps and barriers that we can delve into. Of course, beyond the diagnosis, there's also the barriers to intervention and treatment. And before that, even acceptance of the diagnosis by one's family, by one's community, and even sometimes by the healthcare providers that are supposed to be helping us and being there to support us.
That's a lot of gaps that you've described. And you also mentioned earlier that you see how there are new pathways that are being developed. So if we think pie in the sky, what would the most efficient and best pathway for families on this journey look like?
Maybe how I would describe it is a shift in the frame of mind of how we deal with health issues in general, full stop. So, and I might come from it from also varied cultural backgrounds. I know we're blessed to have so many different cultural backgrounds in Toronto. And perhaps the best pathways can be classified as one that is more of principles of collectivism rather than individualism as the way to design a pathway. So, you know, when we describe the pathway currently of a traditional way of being diagnosed, it really speaks to the individualistic culture of an individual being diagnosed and having to go through a process whereby the individual goes through the system of diagnosis and then referrals towards intervention. It makes an assumption that an individual exists in a silo by themselves. And I think that how we need to design our system is from more of a perspective of collectivism, to understand that there's actually a great big community around a child who potentially might be getting a diagnosis, and it is part of our work as being part of that community of people around a child, whether we're parents, whether we're relatives, whether we're community members that are unrelated by blood, but going to the same school or going to the same mosque or going to the same church. You know, we all have a role in that diagnostic pathway. At the same time, when a diagnosis is made, it's got to be a community approach as well to help the family get through at first, perhaps the shock of a diagnosis, the understanding of what it means in terms of the next steps and interventions, and how interventions are shaped, that they're not always just a one-on-one intervention that cures some sort of disease that we're thinking it might be. It's really a reframing very much of how that whole pathway should look like.
What can family physicians do to help make this pathway more accessible?
Oh, so many different ways. I mean, I can speak to my own profession because, of course, I've been doing this for many years, so I might be a little bit more of a harsher critic when it comes to what we can do as primary care practitioners. So pardon me for maybe not being as generous with sort of what we can and can't do. I do believe that as a primary care provider, because of the breadth of information that we often have to process when we're seeing patients in well child visits or well baby visits, that it's very important for us to acknowledge and understand that the tools that we have are not always that fulsome in grasping at developmental or social disabilities. Many of our tools are made by good evidence. However, it doesn't necessarily address the diversity of the kinds of backgrounds and cultural environments that we all come from. And so to use those screening tools with a keen eye to say that just because a screening test comes out negative or that everything seems fine, that there's much more information that one needs to be gathering. Often that information comes from family members, but sometimes family members aren't also the best individuals to have a look at a child. And going back to my thoughts around collectivism in terms of the pathways, I think one of the best environments that we should acknowledge as family doctors as an environment to really have a good look at for us to understand how a child is doing is having and seeing a child in a school environment. Because often when you have many of the same age children around each other, you can see where the differences lie. And that's probably a more sensitive way of picking up if somebody has social communication challenges, for example.
So as you mentioned earlier, you're also a parent of a child on the spectrum. Did you experience challenges similar to what you have seen the families that you care for face?
Indeed, I did experience some challenges, but I would like to say that I do feel privileged because of being in a healthcare environment and knowing who to talk to and how to navigate the system a little bit better. I will recognize that I have had the fortunate space to be able to work through and navigate that journey maybe a little bit easier than most families that I work with. But I must say, starting from just the challenges of being a parent myself and being part of the family environment that my son was in, I wasn't one to recognize that he had autism. And it had to be from a school environment that the teachers actually flagged for me that there's something here that I need to look into further. And that was a tough one for me to navigate and to accept, but quite a big learning experience, which I think has helped me understand my patients better.
So in speaking with parents in the families that you care for, what kind of comments do you hear from parents about the challenges that they face and all these barriers getting a diagnosis?
Yeah. I mean, that's a very broad question. It varies so much, right? And it depends on where parents are coming from in terms of their readiness or willingness to identify if there's something that needs to be addressed for their child. I mean, certainly barriers to diagnosis can come from a parent. As a parent myself, I've shared that I would say, a barrier to the diagnosis of my own son. So, you do have some parents who will bring up that a school teacher perhaps had mentioned that a developmental assessment was necessary due to a speech delay or some other observations that they might have at the school, but parents might say that, but I think he's fine. My husband or somebody else in the family, I think they're just a little slow to pick up on the words, but I'm sure he's fine. So there's that aspect of us as parents that we might want the best for our children, but may not always feel ready to go down that journey, and I totally understand that. There's the barrier to the diagnosis when it comes to getting a family doctor or a nurse practitioner to get the necessary assessment that is more specialized that may be needed. Sometimes what happens is families go to a primary care provider, and when the symptoms aren't as evident or as severe, it might be that a primary care provider brushes it off for the moment and says, we'll just have a look at this in our next visit in 3 months' time. So there you have a delay then in the provision of the diagnosis and perhaps intervention that we know is much better when started early in terms of its positive impacts. And then of course there's the delay of getting a specialist to see a child. These days that delay is so unpredictable with the pandemic and catching up with all the other pressures in the healthcare system. I would imagine that delay is even longer now. So there's lots, and there's many opportunities for us to make change.
So can you tell us a little bit about the demographic of the community that you currently serve in terms of like culture, ethnicity? What does that look like?
Yeah, so I've got the privilege of working in a community in Toronto that welcomes many newcomers. And newcomers often come as young families. So it's a real pleasure to have young families with young children come through my practice and seek care. And many of them are South Asians. Many of them come from East Asia as well. And more recently, from areas of other areas of war in the world. I mean, it's a neighborhood here that really feels the pulse of the rest of the world, right? So where people have difficulty in other parts of the world, they turn up in Toronto and neighborhoods that have the privilege to serve.
So how do you think culture plays a role in this pathway to diagnosis?
So I'd like to think about it in two ways. One is culture can definitely be a strength, a source of strength for this pathway to diagnosis, and in fact the interventions as well. And then of course there are some aspects of the culture that can delay or prevent the immediate diagnosis and also access to interventions.
Can you speak a little bit about what that looks like, being of East Asian origin and being a parent of a child on the spectrum?
Yeah, I'm happy to do that. I mean, I think speaking to the strengths, I would say that the diagnosis for kids with autism, sometimes for East Asian families, can be one that is brought to a family member and a whole family of concerned relatives, including the immediate family, of course, an extended family, are around one to be able to support you. I mean, I can say that to some extent, that was partly how my own family reacted, but some of my family members also reacted in the other way, which is to say, we don't understand this, and often it's coming from a place of fear and lack of understanding of what a diagnosis for autism would mean. So it plays both ways, I think, for culture. Honestly, I did not know myself how my family would be reacting, but certainly saw both reactions, which for the journey of getting a diagnosis for one's child was both helpful and sometimes even more difficult as well.
Keeping this cultural aspect in mind that you have just spoken of, there's also been a growing concern about families that are lost to follow-up once they receive the diagnosis or once they're on that journey. Why do you think that might be happening?
There's a lot of reasons. However, maybe I'll speak to one reason that might be more evident in terms of specific cultural backgrounds, and I'll speak to my own. I think that sometimes follow-up is lost because there's an element of exhaustion, sometimes embarrassment, sometimes even shame, that this is a diagnosis that's not to be proud of, and from the community lens is not something that would be easily discussed. And so it's multi-layered, right? It's complicated. When I think about those situations, I think about how important it is to bring other community members, perhaps other family members, into the role of advocates for the child. That can be very tricky in environments where it's very specialized. I mean, you know how I am very much committed to primary care as being foundational to our healthcare system. And I believe that family doctors with relationships with extended family members can be very helpful in these situations, because you know who the uncle or the aunt might be that could be helpful in advocating for the needs of a child. I mean, the most well-meaning parents could make mistakes. We're all human. And we rely on our other relatives and other friends who could help us go through this journey.
What would you suggest can be done by diagnostic hubs to retain families as they're going through this journey?
What a wonderful question. Because I do think in terms of how we address some of these barriers, and many of these barriers, there's a great opportunity in diagnostic hubs to approach this, again, similarly as I spoke to you earlier, in a collectivism approach, where it's not so much that it's a one healthcare provider with one child that you're working through an intervention and a diagnosis together, but it's actually a group of individuals, some of whom you might, as a parent, trust more. Not necessarily the doctor. Sometimes the doctor is someone you trust more, and sometimes the doctor isn't the person that you trust more. Sometimes it's that other person that seems more like a peer to you, and that's more accessible in terms of sharing your deepest fears and worries about what this journey is going to look like during the diagnosis and after the diagnosis.
Are there any specific strategies that you use to help Cantonese, Mandarin, and Tagalog speaking families stay on this pathway?
Yeah, I'm glad you asked that. I often will try to, as a family doctor, get a better sense of the social supports around the family. I mean, most immigrants that come to Toronto don't always bring their entire extended family around. And so what I would normally suggest, or typically suggest, is to bring a trusted family member or a trusted friend, whether it's in person or virtually, now it's much more available, to be at a post-diagnosis visit, for example, and have them work together with the family on hearing about the next steps that's needed for intervention, perhaps. There's so much emotion often that comes through with those visits where a diagnosis is made and when a plan of action is made, that a lot of the details get lost. And having a peer, a friend, a close family member who will support is something that I would recommend. I mean, I found it helpful myself, and I think there's much to be said about that, because if I think about the way I trained years back as a medical student, there's something about a diagnosis and intervention where you want to keep it very private, you want to keep it within the individual and maybe the immediate family member, and just keep it very closed. And that's very different from what many parents from East Asian backgrounds would require. Some of them can be very private and want to be very private. And if there's no readiness for other family members to be there, I don't push it. But certainly when there is readiness at the follow-up visits, then I invite having other family members to be around. In fact, if there was a challenging family member that's around, sometimes grandparents or parents-in-law have a harder time understanding what the diagnosis is and having them get on board, then I try to be available for those patients to also help explain the diagnosis to the parents-in-law or the grandparents that need to be and usually are part of the care team once the child leaves the clinic.
Can you briefly highlight some of the tools that are available to family physicians for developmental screening in practice?
So the answer to this question will be different depending on where one practices. So in Canada, in Ontario specifically, in the primary care setting, we typically use a couple of tools. One would be the Rourke Baby Record, which is a screening tool with many questions that is inclusive of some of the social developmental concerns that we might be screening for, but also includes a whole other 50 questions around the health of a child. So there's that, and that screening tool is often used during well child and well baby visits up until 5 years of age. There's also the Nipissing Developmental Screen, which is a screening tool that is self-administered, meaning that a parent can answer and look through. and they tend to be the tools that we use when parents are waiting in the waiting room while they're waiting to have their well baby visit or well child visit, so they can ascertain themselves how they think their child is developing. And that tool is helpful in buying us more time, as in those visits you can imagine that in a half an hour to an hour there's so much to go through that a screening for social developmental concerns can sometimes be a challenge, especially if other issues are brought up. And if you can imagine, a child with autism, for example, would often have picky eating as one of the concerns, and often you can spend so much time talking about how to address picky eating, yet not delve into the developmental screening when it comes to screening for autism.
So, Dr. Yu, what would you want diagnostic hubs to learn from the autism diagnosis experience of your patients and their caregivers?
I think there's a lot of opportunity for diagnostic hubs to move away from the one individual, one service provider, or one family doctor and one specialist approach in terms of arriving at a diagnosis. I think that bottlenecks are created in that way. But also, it is much more impactful when it's a full team approach when you're making a diagnosis. It isn't always easy to come up with a diagnosis, or one can even miss a diagnosis if it's not approached from different lenses. And by that I mean that, for example, we need to have the help of our community members in sharing information and education around autism, so that parents are attuned to what it is that they're looking for and why they're looking for these symptoms or signs early, and what the benefits are of an early diagnosis. There's also that aspect of a diagnostic hub that needs to be not only more community-centric, but also more ready to evolve the ways of doing based on the predominant culture that they're serving.
What advice would you give to family physicians out there to help them better support families who have children on the spectrum?
I think that I would say I understand, as a family doctor, there's so much to go through during those well child visits. Most of the history that we get from our patients are coming through the eyes of their parents. And so I think that one way to help our work as family physicians is to certainly continue to advise the parents to stay connected, for example, in their community where there's an early on center or other group settings for children, such as in the school, and to inquire around how their child is thriving or not in those settings. I think that may provide us with more information than the information that we might glean from just looking at the screening tools that we have, which are good screening tools and might help trigger some of these important suggestions or questions, but certainly to be more mindful that some of these information are best gathered through the eyes of other providers in the community.
You've mentioned the need for interdisciplinary teams working together. You've talked about how there needs to be a more community-centered approach to diagnosis. Practically speaking, how do you suggest that diagnostic hubs and primary care teams can work together to support families? Are there specific strategies that you can suggest or advise?
I have a lot of ideas around this. I think part of it is our fiscal constraints and constraints around what our public health system would fund. So certainly a strategy for primary care would be to ensure that there are other providers, such as peer workers, community health ambassadors, or community health workers that are embedded within the team. And when I think about community health workers or community health ambassadors, they would be ones to have a good cultural understanding of the patients that we're looking after and can help families walk through that journey. It would be so wonderful if, as a primary care provider, I could work in one space with all of those services with me and healthcare providers with me. I mean, I know I'm fortunate to have some of that already. I don't think that that's necessarily available in our system. I do see that with the health human resource challenges that we have in our healthcare system, that's the only way out, is to not rest all of the health human resource needs on primary care physicians or doctors by themselves, but to surround us with interprofessional care team members, inclusive of community health workers and community health ambassadors.
So in conversations that we've had with families of East Asian and Fijian, they have described how it can be a challenge receiving a diagnosis. How can diagnostic hubs engage better with families who might have some hesitation along this diagnostic pathway?
Oh, that's a great question with not only one answer, I think. But I suppose to capture the diversity of possibilities there is that we really need to meet our patients. So diagnostic hubs really need to meet patients and community members where they're at. So I would say that depending on whether the acceptance of the diagnosis is something that's readily there or not, we would have different approaches. I think that when there is less readiness for the diagnosis, certainly it's okay to give the parents some time, and it's okay to leave the diagnosis question and the next steps for a future conversation. But it's not okay to completely drop the follow-up. So I think that follow-ups need to be done. And follow-ups need to be creative in terms of how to connect with the family members. And if there's a strategy to make the follow-up more comfortable for the family, that's how we would approach it. I mean, when there's readiness in terms of acceptance of a diagnosis, then I would meet the parents and the family where they're at again by making sure that the whole suite of services is readily available and as much as possible accessible without as much of the financial burden that often comes with therapy if it's not covered by OHIP or our provincial insurance plans.
So Dr. Yu, you and I have worked together at a school-based pediatric clinic, and I remember at the time we learned a lot about the importance of meeting families where they're at, which is what you spoken about, and the importance of not waiting for them to come to us, but going to where they were. How do you suggest diagnostic hubs can learn from that?
Yeah, I mean, I'd love to answer this question from the health equity lens. I think that we have to think about our privileges and how the social determinants of health are a main factor for our overall community health, so not just as an individual's health. And in many situations where there are socioeconomic disadvantages for certain populations or demographics, it is very important for diagnostic hubs to factor that in and ensure that we in a diagnostic hub come to the place where families and patients can have access to what we're able to provide them more readily. Often for many families, the diagnosis of autism isn't something that's top of mind. Often it's putting food on the table, having shelter, and thinking about other more basic immediate needs. And there's a real opportunity cost if we do not actually seek out those who need our help the most in terms of the interventions that we can provide once the diagnosis is made. So with that in mind, I think that the school clinic program was exactly there for that purpose, was to meet families where they're most comfortable with, which is to say that they want to ensure that their kids are in school and have the education that they deserve and they need, and to make it easier for those families to be able to access diagnosis and therefore intervention is one that we can absolutely help with as we try and address health equity.
Why is it important for hubs, service providers, and specialists to work with community liaisons and community workers to bridge this gap?
It is probably the secret sauce of everything that we do. The community liaison is so important. When we are, again, thinking about health equity, when we're thinking about reaching those who need the services the most, I can't think of any better way of reaching out to them than a community worker, a community a provider who can speak to the families in a way that is accessible to the families, but also relatable and safe.